Hello, everybody, and welcome to another week with live with Dr. McDougall. And today he has a very special topic that a lot of you have been asking for several months, and it's arthritis. And Dr. McDougall is going to give us a very informative presentation. We don't know if there will be enough time for a lot of questions, but we will plan later on for just a session with questions about this topic. Dr. McDougall, please tell us where you're at and say hello to everyone.
Well, I am in Kailua, or excuse me, Kauai, at the Sheraton Hotel with about 65 people. We came on our adventure trip. And I have to say the food is the best food we've had at any adventure trip. The chefs are doing an amazing job. People are overwhelmed. You know, we usually get more people to come on adventure trips, somewhere between 100 and 140. Somehow or another, a lot of people missed out on this trip, and they should be here. It's just amazing. We were out yesterday on the catamaran, and we saw about 8 whales and a couple of calves, and it was just a beautiful thing. Anyway, we're gonna do something next year. I think we're gonna go to Maui next year. At least we're gonna see if people would be interested in going to Maui.
Mm-hmm. Very good.
And it should be. That's the most popular of the islands. Our favorite island, of course, is the Big Island, which we've been to twice in the last 2 years. And we've also thought about doing a trip to Oahu. And that's where Mary and I lived for 12 years. We lived 3 years on the Big Island and 12 years on Oahu. So we're having a great time. I mean, the people that we have with us are having, and many of them are travelers. I would say half the people have traveled with us before, and they say this is the best adventure trip they've been with us. So you missed out.
Oh,
I know, Gustavo, you really wanted to come.
I really do. I really did want to. If anybody's here on this call from Singapore, I will be there next week giving a concert. So
yeah.
Come see
Well,
here. Okay, Dr. McDougall.
Okay, let's go ahead and get started. Maybe we can get slides to work. What we need is a good tech person to help us out.
Right.
So we get these things going like they should. Half the time we get it right, and half the time we get it.
Sometimes technology is a little bit
but you know, we're not dumb people. We should be able to figure it out.
Well, yes, but yeah, sometimes things don't behave the way they should. Yeah. Let's see. I see that you are okay. Very good. We see your slide there, so I'm putting that on the screen for everybody to see.
Well, I just can't tell you how often people come up to me and talk to me about their arthritis, particularly inflammatory arthritis. Like we have one man here. He's an 80-year-old Japanese man that we've known for many, many years, and his wife reminded me, we were out on the boat, that they contacted me 13 years ago, and he had severe crippling rheumatoid arthritis. I mean, he was essentially bedridden. And they started the diet, and I didn't remember this. You know, I can remember a lot of the patients. I didn't remember it. And she said, he's been arthritis-free for 13 years, and they go on every one of our trips. So people come up to me all the time, and they say, I know you're tired of hearing this. And I say, no, I'm not. You know, tell me. And I can't tell you the number of reports that I get from people by email, or if they meet me at a meeting, where they say, you know, I know I'm wasting your time to tell you what happened to me, but I had rheumatoid arthritis. I was essentially crippled, and changed my diet, and it'd been completely gone. And if you want to read about 10 cases of severe rheumatoid arthritis, psoriatic arthritis, that people were willing to post it on our Star McDougall section of our website. Just go to my May 2014 newsletter, and you'll hear some amazing stories of people whose lives were completely turned around by changing their diet. So it's fun. I'd have to say it's one of the most fun diseases to take care of is inflammatory arthritis. inflammatory arthritis are like rheumatoid and psoriatic and lupus. These are the autoimmune diseases, and they're the most fun to take care of because they get better so fast and so dramatically. When I first discovered the relationship between arthritis and diet, it was from a book, a little booklet that I got in 1978 from the Arthritis Foundation. The booklet was titled "The Truth About Diet and Arthritis." And I read through it, and what it said: the truth about diet and arthritis may surprise you. It is simply this: there is no special diet for arthritis, no special food has anything to do with causing it, and no special diet will cure it. And anybody who thinks so, they're food fanatics and peddlers of health and nature foods. I said, boy, they really must have this all figured out, well studied, because nobody would make a statement like this to doctors and to patients unless it was absolutely certain to be true that diet did not cause inflammatory arthritis, nor could you make it better by changing your diet. Well, I happened to be at Queens Medical Center, and on Queens Medical Center was the Hawaii Medical Library. So I had access to the medical journals. So I decided to spend my time in the library finding all of these articles. I mean, probably hundreds of articles where they had tested diet on people with inflammatory arthritis and proven that it makes no difference at all. Well, at the end of a week's search, I found not a single article that supported their statement. Instead, I found about 20 articles that show people with inflammatory arthritis are cured when they change to the kind of diet I recommend, or fasting. Fasting also was a part of the treatment, but you can't fast forever, so they'd fast for a while and then they go on a low-fat vegan diet and they'd stay cured. I mean, I had at least 20 articles that said that. And how in the world did the Arthritis Foundation get in the way saying to patients and doctors that it was absolutely proven that this was not the case? And the patient comes into the doctor with arthritis and says, I think it gets worse when I eat cheese. And the doctor says, nah, it can't be. It's all in your head. How do you know that, doctor? Well, the Arthritis Foundation put out a pamphlet that says that's not the case. And so, you know, the patient doesn't stand a chance. The patient reads the brochure, the patient says, well, I must be crazy. It has nothing to do with the disease. Now, that was 1978, I got that brochure. These days, this is what the Arthritis Foundation says. Well, there is no specific diet that people with rheumatoid arthritis should follow. Research have identified certain foods that can help control inflammation. Many of them are found in the so-called Mediterranean diet, which emphasizes fish, vegetables, olive oil, among other staples. So, you know, they're kind of getting into the Mediterranean diet trend and knowing that it may help with heart disease and general health. Well, the reason the Mediterranean diet would help any kind of arthritis is because the Mediterranean diet is a diet high in fruits and vegetables. But I do want to point out with their statement, they have a picture of what you should eat, and it contains cheese and olive oil, which are two of the worst things that you can feed somebody with inflammatory arthritis. There are other kinds of arthritis. There's gout, which we're not going to talk about, but gout is the disease of kings and queens. You get it from eating lots of meat, and what happens is purines, uric acid builds up in your joints and gives you these terrible deforming arthritis. And then there's what we call wear and tear arthritis, which is also called degenerative or osteoarthritis. And 70% of people age 65 have osteoarthritis in our country. But osteoarthritis is essentially unknown in places like Africa and Asia, where they work really hard. I mean, they toil in the fields, they carry baskets on their heads. And when I say essentially unknown, that was before 30 years ago. You know, in the last 30 years, people living in Asia and Africa and India and other parts of the world have changed to the Western diet. So this data comes from before, when people ate differently. And then there's the kind of arthritis that I want to talk to you about for just a few minutes. Inflammatory arthritis, we're talking about lupus, psoriatic arthritis, nonspecific arthritis, rheumatoid arthritis. Some researchers believe that rheumatoid arthritis did not exist anywhere in the world before 1800. And it is well documented that these forms of arthritis were once rare to non-existent in rural populations of Asia and Africa. But these are people who took great effort to look over the health of tens of thousands of people, and they couldn't find any rheumatoid arthritis. In fact, the first case of rheumatoid arthritis was identified in Africa in 1957. Now the African American who lives in the United States, they have the highest incidence of lupus of any subpopulation of people. So something's changed. Here's an article about South Africa, about rheumatic diseases, and it talks about the fact that they can't find any rheumatoid arthritis or ankylosing spondylitis in the entire population that they examined. A study from China, and again, this is more than 30 years ago. They could find almost no inflammatory arthritis among the Chinese people. But these days, they have the same incidence of these kinds of arthritis as do Americans because they've changed their diet. They eat as rich as Americans do. Now, as far as treating rheumatoid arthritis, one of the first studies that came out was a case report of a person who was eating the American diet and decided to change to a vegetarian diet, and especially to get the dairy out of the diet. And the person was cured, and they published that in the British Medical Journal. Early cases of dietary therapy using diets that were vegetarian, vegan, especially taking the dairy out, were published in 1983. This is one of the best studies. This is out of Lancet. This was a controlled trial of fasting and 1 year vegetarian diet in rheumatoid arthritis. Now, it was a juiced fast that they fed them for 1 week, and every one of the patients got dramatic relief of their arthritis. Every single one of them. And this is in the Lancet. This was published in one of the best medical journals in the world, the Lancet. And they got those kinds of results, and they followed up on these patients. And what they found is that those who adhered to the diet kept their rheumatoid arthritis away. This is a follow-up on that diet, a 2-year follow-up showing that those who stuck with the vegan, low-fat vegan diet did extremely well. We did a study back in 2002, we published it, on patients with rheumatoid arthritis. And we put them on our diet, and what we got was that 70% of them showed improvement in their symptoms. To get rheumatoid arthritis, what you have to do is you have to damage the gut, intestinal tract. You get a leaky gut. It becomes like a sieve. Substances, in particular proteins, pass from inside the gut into the bloodstream with no discrimination at all. They just passively go through. And as a result, you get foreign proteins in the blood that aren't supposed to be there. These foreign proteins get through the gut wall in normal people, but also they get through the gut wall in people who have celiac disease, which is less than 1% of the population. But people who have celiac disease have a high incidence of having multiple autoimmune diseases. What happens is the normal border of the intestinal tract, which you see there with all of the little mountain peaks there, wheat, barley, and rye are toxic to these villi. And what happens is they get knocked down, and the absorptive surface of the gut it becomes flat, and it also becomes leaky, and then more of these proteins can get in. So people with celiac disease are more likely to have thyroiditis or rheumatoid arthritis or lupus or other types of autoimmune diseases because they have that damaged gut. But you don't just have to have celiac disease to have a damaged gut. It's been shown that dietary fat is toxic to the intestine and causes an injury that leads to leaky gut. High cholesterol diets cause a leaky gut. And what I'll show you a little bit in a little bit of time is that people who go on a vegan diet, who add vegetable oils to their diet, their arthritis comes back. So vegetable oils are toxic to the gut also. Let's talk about molecular mimicry. What we're talking about here is mimicry, and mimicry means copy, and we're talking about copies of foreign proteins. They get into the body. These are food proteins. They get into the body, and the body makes antibodies. That's what you see here is a lymphocyte, and those little wild type things, those are antibodies. So the lymphocyte comes in contact with the foreign protein, say cow protein, cow milk protein, pork protein, various kinds of foreign proteins. Because of the leaky gut, these proteins got through intact in the bloodstream. And so now the body has to defend itself against these foreign proteins. So the antibodies make these, the lymphocytes make these antibodies, which are the little Y-shaped drawings there. And then they go out in the bloodstream and they look for the foreign protein. And here you have a situation which occurs in everybody, probably every year. You have a foreign protein getting into the body. This is a virus. And the body makes antibodies to that virus. And those antibodies are very specific. They're like lock and key. The virus has a protein coat structure that the antibodies are made specifically to attach to. And that's one of the reasons that flu viruses don't work, or flu vaccines don't work, is because every year a different kind of flu virus comes through with a different protein structure. And although the body made a effective antibody after about 2 weeks to the virus, the flu virus that came through last year, the new virus that comes through has a new protein structure, and it takes a couple of weeks to make new antibodies. Otherwise, if it was the same protein structure as the previous year, you wouldn't get the flu. The antibodies would just go out there and kill the virus. The point I want to make here is your lymphocytes make these antibodies specifically to the foreign protein. And what happens, like for example, when you consume cow, beef, with somebody with a leaky gut, what happens is the beef protein gets into the blood. The lymphocytes interpret that beef protein as a foreign protein, like a virus, and it shouldn't be in there. And what it does is it makes antibodies to that beef protein. Well, because beef is an animal like people are animals, we have similar proteins in our tissues as beef protein. And as a result, what happens, the lymphocytes make the antibodies, those Y-shaped structures. They go out to find the what we call antigen, or the sequence of proteins on the surface of the beef, and they attack that beef protein. But what else happens is they find similar proteins in our bodies, similar to the beef protein, and as a result, they make antibodies to our own tissues. All right, same thing with milk. Here you have someone drinking milk. The milk protein, say the beta casein, gets through the gut wall because of a leaky gut. And once it gets inside, the body says this milk protein should not be in here. It could be a virus. I'm going to make antibodies, so it makes antibodies to the surface proteins. And those antibodies attack the milk proteins. Actually, it's been identified. It was identified in 1992 in the New England Journal of Medicine. It was identified the 17 amino acids that are present on milk protein that cross-react with human tissue. In this case, joint tissue, causing rheumatoid, or actually causing, no, in this case, it was a reaction to pancreatic tissue, causing type 1 diabetes. It was 17 amino acids that they found on the milk protein that were also present on the pancreas. And so the body is out there trying to defend itself, attacking the milk protein, but it also attacks our own tissues. Like in this case, the beta cells, or the insulin-producing cells that are in the pancreas. The antibodies are looking for the milk protein, the 17 amino acids on the milk protein that they're out after to attack, to kill that milk protein in the body. And in its process of looking around for those particular 17 amino acids, it finds those same 17 amino acids in the same structure in the pancreatic cells, and it attacks those cells and kills those cells. And as a result, you end up with type 1 diabetes. It takes about 3 to 5 years to kill, on average, to kill all the cells in the pancreas and to become a type 1 diabetic. You see the same thing in joint tissues. We've identified a cross-reaction between milk protein and the cartilage tissue in the joints. So you eat milk is common, a very common inducer of this kind of a reaction, molecular mimicry. And so you drink the milk goes through the intestine, the leaky gut. It's floating around in the body. The body makes antibodies against one segment of the milk that has a similar, and in fact exact, sequence of amino acids present on the cartilage tissue, and it attacks the cartilage tissue and it becomes inflamed. And then you have rheumatoid arthritis. This type of reaction goes along with all common autoimmune diseases. Now, I'm not trying to tell you that only food causes these diseases, but I believe that in most cases, food is the cause. It is the inciting agent that causes the body to make antibodies against something foreign. Like, for example, when people get alopecia, hair loss, well, the body makes antibodies to hair follicles. Foreign hair follicles, by the way. They'd be hair follicles, say, from a cow or a pig. And they cross-react and they attack the hair follicles. Crohn's disease, type 1 diabetes, juvenile rheumatoid arthritis, lupus, multiple sclerosis. In that case, we have very solid evidence that's what happens, is that we get a leaky gut, milk protein gets into the bloodstream, and then the body makes antibodies against a certain segment of that milk protein. And then what happens is, because of the diet people eat, which is full of fat, the blood-brain barrier is made incompetent. And now the antibodies that were made in the blood against cow's milk protein, they now can leak through the blood-brain barrier, and they go and attack the myelin sheaths. And as a result, you get multiple sclerosis. All kinds of things, polymyositis, pernicious anemia, psoriasis, relapsing polychondritis, whole list of them. You can go back and review them. Thyroid, people who have thyroid problems. You go to the doctor and ask, why did I lose my thyroid? Why am I hypothyroid? The doctor says you have autoimmune thyroiditis. Autoimmune thyroiditis, in other words, your body attacks your thyroid gland. Well, why does your body attack your thyroid gland? Well, this is just kind of a made-up thing that I think is true. I don't have any scientific evidence to this, but it makes sense. What happens is that people eat foreign thyroid glands. And the foreign thyroid gland goes into the bloodstream. The body makes antibodies for this foreign thyroid gland. And because our thyroid tissues are so similar to the foreign thyroid gland tissues, the antibodies attack our own thyroid glands and kills the thyroid glands. Now, how do people eat foreign thyroid glands? It's called hot dogs, sausage. You know, when you go to a slaughterhouse, they waste nothing. You know, they take the thyroid glands and the testicles and the spleen and the liver and the tendons and everything, and they grind it up and they flavor it and put it in a sausage. So people are constantly bombarded by these foreign tissues, and in this case, foreign thyroid gland tissues, and that's how I think you get hypothyroidism. And all doctors call it autoimmune thyroiditis, so they know it's an autoimmune disease. Anyways, there's vitiligo, where the reaction attacks the pigment cells of the skin, and so on. All kinds of autoimmune disease, and it's due to eating foreign tissues. But they can't be too foreign. They've got to be in the animal kingdom so that we can have copies of those foreign tissues in our tissues. In other words, if plant proteins got into your bloodstream and the body made antibodies to these plant proteins, because plant proteins are so different than animal proteins, you wouldn't have that cross-reactivity. You wouldn't have an antibody produced against some type of plant protein going out and finding that protein in your system, because you don't have it. Because the kingdoms between the animal and the vegetable kingdom are so great, you don't get the molecular mimicry that occurs. All right, so the foods you eat to cure inflammatory arthritis is the basic McDougall diet based on starch. I want to emphasize this again and again and again. I get this whole group of people here. We have 65 people here. And as I told you, over half of the people here have been friends of ours for a long time and traveled with us many, many times. Many have been to the 10-day program also, and I just get this message over and over and over again in so many different ways. And I gave a lecture last night about starch and losing weight. And a couple of people came up to me and they said, you know, I just didn't realize how much starch I was supposed to eat. You got to get this in your mind, the fact that you are a starch eater. The amount of starch you should be eating should be somewhere between 70 and 90% of your calories. Most of your food should be starch. You should have a little bit of non-starchy stuff like kale and broccoli and cauliflower. But most of your diet has to be starch. And once you get that, then you get control. Then you get satisfaction. And then you get the healing that you need. If you're eating a diet that's 90% green and yellow vegetables, you're starving to death. You know, these macronutrient or supernutrient diets that are based on those kinds of green and yellow foods, they don't make it. So you eat a starch-based diet, and then you can add some non-starchy vegetables. That's fine. They add color, flavor. They add some vitamin A and C, which is nice to have. And you can also eat some fruits. And that's the basic diet for curing these autoimmune diseases, including inflammatory arthritis. Now, I have to tell you, from my experience, and when you read my May 2014 newsletter, you'll see how I feel about it. I haven't seen so few people who have not responded to the kind of diet I recommend. Those are the people that I remember, like 2 or 3 or 4 in the last 30 years. The other people have gotten tremendously better. And the healing starts in about 4 to 7 days. You can see the benefits. And usually by 4 months, all of the inflammatory arthritis is gone. Now, you're still left with deformities. The damage that was done to your fingers, where your fingers are all crooked, it's not going to straighten out with a good diet. But the attacks, the autoimmune attacks are going to stop. And the benefits are going to be tremendous, just like Jim Higa, who I was telling you about at the beginning of this, he had rheumatoid arthritis 13 years ago. And it's completely cured. And he's on the trip today. He's 86 years old. And yeah, it is the cure, because the cause is the rich American diet, in particular the animal nothing but water. And then what they did is, after the fast, they put him on a vegan diet, which was high in vegetable oil. And during the vegan diet, high in vegetable oil, both the signs and symptoms returned in most patients, with the exception of those with psoriasis, who continued to experience improvement. So they put him on a vegan diet, 42% fat. You know, added things like, I don't know what the exact oils were, but your vegetable fats are olive oil and corn oil and safflower oil and flaxseed oil and so on. So I have to stress, if you're going to get the benefits from these inflammatory diseases, you must get the oil out of the diet. The oil interferes with the immune system, and I'm sure does many, many other things. So don't be disappointed if the diet doesn't work. If you become a vegan, you have to become a no oil vegan, a very low fat vegan. Now, the next step that I take, if somebody doesn't get well, I mean really well, yeah, these are things you don't have to say, oh, I guess my fingers feel better, or I guess I'm less stiff. I mean, you really know you're well when you go on the diet that I recommend. But just say it doesn't happen like I suggest. Then the next step I take is I put people on an elimination diet. And that diet is very restrictive, but it is also very powerful. It removes other common allergens, and it has a reasonable extra step in terms of benefiting people who aren't doing as well as they should on the basic McDougall diet. And that diet is made of all cooked foods, because cooking breaks down some of the proteins that interact and cause inflammation. So the elimination diet is based on rice and potatoes, sweet potatoes, and taro, and winter squashes. You can also have non-starchy green and yellow vegetables, all cooked. I mean, this is just a partial list, but pretty much all non-starchy green and yellow vegetables work. And you can also have fruits, but I've limited the fruits to non-citrus fruits. And they're all cooked, again, to denature the protein, so you're less likely to have a reaction. The elimination diet is followed for at least a week. And by that time, you've cleared most of the bad food, the food you ate before, out of your intestine. And at about a week, you start seeing tremendous benefits. And you go on with the elimination diet, maybe for a few more days, and then you start adding foods back. Healthy foods that you like, say white potatoes or beans and so on. And you add them back, one food at a time. You give it 2 days to test. And if you don't react, then you can add those foods back to your diet. So that's the next step in terms of taking care of somebody who has an inflammatory or autoimmune disease. And then the last step that I use, but I have to say I don't see much change. But patients are desperate, and I want to try anything possible that I can do to help them. You know, if I wasn't able to figure out what the problem was and to help them, the last step that I do is I send them to my friends at True North, which is a water fasting facility. A great reputation, wonderful people, and they go in for a water fast. But I have to tell you, after I've been through the elimination diet with people and put reasonable effort into it, when I send them over for a water fast, I very rarely see the magic ingredient that we missed, and that they get better. But you got to try everything, and the water fast is the last step, and the most pure of all diets. And how more pure can you get than distilled water? All right, so I'm ready for some questions, Gustavo.
Yes, Dr. McDougall, thank you for that. I really liked your comments near the end. Well, everything, but especially the no oil and your elimination diet.
Really important.
Very good, very important. We only have about 5 minutes left, but I want to assure everybody that we will do a question and answer with you later on about this topic, because there are many questions. So let's see. Let's open here the chat box and have some questions typed by people. I wanted to ask you one question about some of the damages that are irreversible, because I think sometimes people think that just eating a potato or a sweet potato now is going to reverse damage of years. So what are the reasonable things that people can reverse?
There are, and that's it. People do get disappointed. They come in with crooked fingers and frozen fingers, and they expect those to go away. I mean, that's scar tissue. What you can expect is you can expect the attacks, the inflammation to stop, and the progression of the disease to slow down or stop. I mean, you're getting older, so there's going to be some degeneration there also. You have to be reasonable. But the results, particularly if you get people younger, maybe a year or two into their disease, the results are phenomenal.
Right.
As you read in the May 2014 newsletter, you will read about people who were bedridden, couldn't pick up their children, who couldn't go to work. I mean, their whole life was ruined by this disease.
Right.
In a matter of a few days, it started to get better, and sometimes it took 3 or 4 months to get really better. But,
right.
It's a life changer. It costs nothing. Absolutely no side effects. I would never do it.
So can you rebuild cartilage after it's worn out, or is that not possible?
Probably not. I say probably not, but there is some evidence that you can rebuild cartilage with osteoarthritis. There is an article I have, and I don't know whether I have it up in on my May 2014 newsletter, but it's someplace. Just type in osteoarthritis in my search box on my website, and there's an article that was published many years ago where they actually showed reversal of cartilage damage, but I wouldn't expect much of that.
Right, right. Of course, this question comes up every single time, and it's: is there any level of oil that is safe to eat? I guess that's really hard for people to give up. Can you say it?
It's the level of oil that is naturally present in rice, and it has to come with the rice.
Right.
And for people who have these autoimmune diseases, I usually start them out with a diet that is gluten-free. I also start them out without soy products.
Right.
The reason I do that, I showed you the gluten-free issue. You may be catching people who have this damaged gut. The reason I don't feed them the soy products is because the people eat so much soy, and most of the soy that they eat is very high in fat. Soybean itself is about 30% fat. You go to tofu, which is 50% fat. And then they go to these fake foods, these fake cheeses and fake burgers and hot dogs because it's vegetarian. And so I just blanketly tell them in the beginning, don't eat soy products, and stay away from wheat in particular, because that's the common gluten food they eat. And that's the only limitations that I put on them when they first start the diet, and that's not a big deal. So
right.
But it's just to give an emphasis to make sure more people get better sooner.
Right. Someone is asking about taking probiotics to help in repairing the leaky gut. What do you say?
Well, there's good research that's published in excellent journals about probiotics being helpful, but they feed them along with a vegan diet. So there is evidence to suggest that. I've never taken that step for my patients, putting them on probiotics. I've never seen a patient that I can recall that came in and said that taking probiotics made a big difference in terms of my inflammatory arthritis, but you can easily find very well done research in very credible journals if you look at probiotics. But they also, as I say, they combine it with the kind of diet that I recommend.
Right, right. Very good. I just want to mention to everybody to send the questions that you have to webinar@drmcdougall.com so that I can collect them for our next webinar here with Dr. McDougall. We will have to quit, unfortunately. It's been 45 minutes.
You want to just take 1 second to see?
Can you just show us a little bit? And while you do that, I'm going to switch the camera here to me so the movement doesn't make people dizzy. And I'm going to put here on the screen the information for everybody to register for next week's webinar, which is with Dr. Doug Lyle. And it's going to be a wonderful webinar with him. Dr. Doug Lyle is a psychologist that works with Dr. McDougall, and I see a wonderful view. Let's see here if we can. Well, it's kind of we may have lost the connection with Dr. McDougall here. just be aware that we're transmitting from, I'm in Dallas.
To know that even though Mary and I are working really hard here.
Yeah, we did not see that the connection was cut off, Dr. McDougall, and we did not see the outside that you were showing us. Now we can see it. Yeah, there you go. Oh,
yeah, I see the fishermen out there killing fish.
Yes, you are making us very jealous right now. And well, everybody, make sure that you visit drmcdougall.com, because that's where he posts the upcoming webinars, and I think not webinars, the upcoming trips, I meant to say. And you are having the advanced study weekend, right?
Right. Oh boy, we have about 300 people signed up, but you know there's room for others. We just have to put you in other hotels, and it's going to be a classic weekend. It's the 12th.
Yeah, I am showing it right now. If you go to drmcdougall.com and go under programs right here, you go under the advanced study weekend, you arrive to this page where you can sign up.
We will get you in. It's just that we will have to have you have other transportation, and it's not far away to other hotels like the Marriott and the Hyatt, and we have hotels that are quite close. So, you know, you'll have just as great a weekend. We'd love to have you there. It's going to be an amazing weekend.
Yes, it is. I can testify to that.
And I want to mention something else. We wanted to show some videos of people who had rheumatoid arthritis and other kinds of arthritis, but we weren't able to get them to play. Please take the time to go to the May 2014 newsletter, and not only, and you'll read about 10 cases of people who had, life damaging,
right,
a disease that it can be fatal. And we have at least 3, maybe 4 video testimonies that are emotionally impactful. And if you want to have any motivation for yourself or your friends to take a chance, which is no chance at all, to eat a diet that costs nothing.
Right.
And show them those videos of these real life people whose lives were changed just by simple dietary change.
Very good. We'll do that, and we will plan on showing those videos in our part 2 of the arthritis webinar then.
Yeah, we could do that. Maybe we should ask our audience if anybody's an expert in doing this and getting our things to. They have any suggestions on how we can get PowerPoint to play consistently and properly in our webinars.
Very good.
Don't hesitate to write us and let us know, because this has been a challenge for us ever since we started. And we do it right sometimes, but other times it just doesn't come together.
Not consistent. No. We'll work it out. Well, thank you again.
Have a good time in have a good time in Singapore.
I will try it. Hopefully, I will be able to find something to eat.
They got rice.
Right, exactly. That's
no trouble at all. Just eat
rice and vegetables.
Yeah, Tom, cook them without oil. You'll do great.
Okay. Well, thank you
very much for your help. And folks, we'll join you next week. You'll be in Singapore, right?
I will, but we will be doing Dr. Lyle's webinar next week.
Dr. Lyle next week. Okay.
It is still scheduled.
Next time I see you,
it'll be 2 weeks from today.
It'll be 2 weeks, and we'll be both back in our usual.
I know. Yes. Right. Okay.
Great
Goodbye,
time.
everybody. Thank you.